To your health this morning. For the first time, a woman in the U.S. has given birth after receiving a uterus transplant. The new mother from Texas and her newborn baby are doing well. The transplant, part of a clinical trial to study new infertility treatment options for women who don't have a functioning uterus. So what does all of this really mean? Dr. William Schoolcraft, the founder of Colorado Center for Reproductive Medicine, is here with some insight into this news and a uterus transplant. Good morning.
Good morning.
Is this a surprise at all? I mean, I know you in your field, you hear all of this, but this is a study that has been happening for some time, right?
It has. It started with some work in Sweden, but this was the first actual successful birth in the United States from the Baylor School of Medicine.
What does this really mean in your field and for women who struggle to get pregnant?
Well, it's mind-boggling, but it means women without a uterus can have a baby, which doesn't make a lot of sense. But women who are born without a uterus or lost their uterus due to cancer can have this transplant procedure and actually carry a baby themselves to term.
Wow, we know you see thousands of patients and you help thousands of couples. Do you have many patients that would qualify for this or who would want to receive this type of treatment?
I do, and it's been estimated there's 100,000 women in the U.S. who have a uterine factor as their reason for infertility. Traditionally, they've had to have another woman carry a baby called the gestational carrier, but this would be an option to carry themselves.
And that seems like it would be a much easier option in having someone else carry the baby. But for many of these women, it is something that they just want to experience. They want to be pregnant.
Yeah, their drive to want to carry the baby themselves is hard to describe. They may also have religious or philosophical reasons why having another person carry the baby is not acceptable. So I think for a subset of women without a uterus, this may be the only acceptable option.
Now that being said, it's a serious surgery and a difficult one at that.
Very much so. It's a serious and major surgery for the woman receiving the uterus. It's very serious for the woman donating the uterus. It's not a simple procedure to take out the uterus and preserve all the blood vessels necessary to make the transplant work. So huge commitment for both parties.
I found it interesting. You told me in the break that when this first was started in Sweden, correct?
Correct.
That it was sometimes the mother who gave the uterus to a daughter.
That's right.
Fascinating when you really think about that.
Yeah, these mothers were sometimes in their early 50s, so women were getting a 50-year-old uterus. Sometimes the women were near or in menopause, and yet they could put it in a younger person, and with the right blood flow, it would function to carry a baby. So just changes our thinking about what's possible.
And then is the uterus removed after the baby is born?
Typically, after 1 to 3 years, once the woman's had a baby or at the most 2 babies, they would then remove the uterus because the woman has to be on anti-rejection drugs like a kidney transplant, and so to leave it in long term isn't good for the person's health.
Wow. Do you anticipate that we'll be hearing more about this in the years to come, and would that be something that we could see happening here in Colorado?
Yeah, right now there's 2 big medical centers that have research studies, so we're going to hear more about new births, new cases, and I think as it becomes perfected, other centers, like here in Colorado and other major centers, will initiate this treatment.
Well, Dr. Schoolcraft, thanks for coming in this morning.
Absolutely.
Always good to see you.
Sure.
Fascinating stuff. We'll be right back.
Thanks.